Hi everyone, Haley, Mia, and I will be talking about Crohn's disease today.
So I want to give a brief overview of what Crohn's disease is. It's a chronic inflammatory bowel disease of the digestive tract, and it can be extremely debilitating and painful. It affects about 3 million Americans each year, which is pretty significant, and it affects both men and women equally. So there is no exact known cause of Crohn's disease, but scientists believe that there are hereditary, genetic, and environmental factors that have to do with the cause. They also know that stress and diet play a role in Crohn's disease, although they do not cause it. They aggravate and agitate the disease and cause more of an inflammatory and immune response in the digestive tract. And they also know that it can occur at any age, but is most prevalent between ages 15 and 35. And as you can see in the picture on the right, here is what a normal digestive tract looks like in the lumen of the colon. And in Crohn's disease, you can see the inflammation and the redness. And here you can see the colon is inflamed and agitated. So next, we're going to talk about the mechanism behind Crohn's disease in regards to the immune system. So an abnormal immune response occurs, and this causes inflammation of the digestive tract. Normally, our digestive tract is filled with what is considered good bacteria, which you can see in the image over here. But with Crohn's disease, your immune system attacks that bacteria that normally lives in the digestive tract and helps with digestion of food that we intake. And this causes inflammation and the symptoms associated with the disease. So bacteria will bind to the antigen presenting cell, and this will cause a cascade of events that will take place. And eventually the macrophage will kill the bacteria within the digestive tract. And this causes all the symptoms associated with Crohn's disease, which we're going to talk about next.
Some signs and symptoms of Crohn's disease is diarrhea, fever, fatigue, abdominal pain, blood in your stool, mouth sores, reduced appetite or weight loss. Some other signs and symptoms could be inflammation of the skin, eyes, and joints, or inflammation of the liver or bile ducts, kidney stones, iron deficiency, or delayed growth or sexual development in children. It is recommended to see a doctor when having abdominal pain, blood in your stool, nausea or vomiting, diarrhea that doesn't respond to over-the-counter medication, an unexplained fever for lasting more than a couple days, and unexpected weight loss.
There are several risk factors involved with developing Crohn's disease. The first one is age. Crohn's disease can develop at any age, though you are more likely to develop this disease when you are young, and many people who develop Crohn's disease are diagnosed before the age of 30 years old. Ethnicity also plays a role in developing Crohn's disease. Although it can affect any ethnic group, whites have the highest risk, especially those of Eastern Europe and the Jewish descent. However, Crohn's disease is increasing among Black people who live in North America and the United Kingdom. Family history also plays a factor in developing Crohn's disease. You are at a higher risk if a first-degree relative has or has had this disease, and 1 in 5 people with Crohn's disease have had family members with the disease as well. Lastly, non-steroidal anti-inflammatory medications also have an impact on developing Crohn's disease. These include ibuprofen, such as Advil, naproxen sodium, and others. These medications do not cause Crohn's disease, but they can lead to inflammation of the bowel that makes the disease worse. Cigarette smoking also has an impact on Crohn's disease. It is a controllable risk factor for Crohn's, and it also leads to a more severe disease and increased risk of needing surgery if you have the disease. It is important to be mindful of these risk factors, especially if you have family members who have had this disease or you are of the certain ethnicity that is also prone to developing this disease. In order to diagnose Crohn's disease, doctors typically use a combination of tests to diagnose the disease. Your doctor will also ask you about your medical history, including medications you are taking and your family history. The first example of a test used to diagnose Crohn's disease is a CT scan. They also use diagnostic tests such as lab tests, blood tests, stool tests, intestinal endoscopy, upper gastrointestinal, GI series, and computed tomography CT scan. The intestinal endoscopies are the most accurate methods for diagnosing Crohn's disease and ruling out other possible conditions such as ulcerative colitis, diverticular disease, or cancer. They can also include a colonoscopy. Blood tests include a healthcare professional taking a blood sample from you and sending it to the lab to test for changes in red blood cells. So if your red blood cells are fewer or smaller than normal, you may have anemia. They also test for white blood cells. When your white blood cell count is higher than normal, you may have inflammation or infection somewhere in your body. Doctors use stool tests to rule out other causes of digestive diseases, and an upper GI series is a procedure in which a doctor uses x-rays, fluoroscopy, and a chalky liquid called barium to view your upper GI tract. And CTs can also diagnose both Crohn's disease and the complications of the disease. Physical examinations are also involved in diagnosing this disease. The doctors will provide a typical physical examination and check for bloating, listen to sounds within the abdomen using a stethoscope, and they will also tap on the abdomen to check for tenderness and pain and to see if your liver and or spleen is enlarged. Again, these tests are used to make sure that Crohn's disease is what is happening in the body and not other symptoms such as anemia or other digestive diseases. This is an image that shows an example of what a normal intestine looks like and then what an intestine looks like when Crohn's disease is present. This is the normal intestinal surface and the normal wall of the intestine. And when there's Crohn's disease in the body, cobblestone-like intestinal surface will look like this, along with a fissure and thickened walls as well. And there's also fat wrapping around the intestine that is not present in a normal intestine.
Some treatments include anti-inflammatory drugs such as corticosteroids, which reduce inflammation in the body, and these are generally only used when a patient does not respond well to other treatments. Patients can also be prescribed immune system suppressors such as azathioprine and maricoprine, which help treat inflammatory bowel disease. Biologics can also help treat Crohn's disease by stopping certain immune cell molecules from binding to other cell molecules in your intestinal lining. If all these do not work, simple antibiotics can help reduce the amount of drainage from fistulas and abscesses, which can sometimes heal people with Crohn's disease. Some other medication include anti-diarrhea pills, pain relievers such as Tylenol and Advil, or vitamin and supplements if the body is not producing enough. Nutrition therapy is always an option. A doctor may recommend giving the patient a special diet or even a feeding tube that contains nutrients to help treat the Crohn's disease, which will improve your overall nutrition and allow the bowels to rest. Bowel rest will reduce inflammation for the short term, so more procedures or medication will have to be used after the nutrition therapy is done. If diet, lifestyle changes, drug therapy, or other treatments don't relieve Crohn's disease, your doctor may recommend surgery. Nearly half of those with Crohn's disease will require at least one surgery. However, it does not cure Crohn's disease entirely. During the surgery, the surgeon will remove the damaged portion of your digestive tract and then reconnect the healthy sections. The benefits of this surgery are usually temporary and the disease often reoccurs, so the best approach is to follow the surgery with medication to minimize the risk of reoccurrence. As for the prognosis, there is no cure, but people tend to live happy and active lives as long as lifestyle changes and medications are being taken properly.